there is a new CDC announcement out, and it is about plastic surgery. And it's because there's kind of been I don't want to say a pandemic, but a rash of pretty rare fungal meningitis infections that have popped up. And because that's kind of a really rare occurrence, like usually it's viral meningitis and occasionally bacteria, but fungal meningitis is rare, they kind of trace them all back to this plastic surgery clinic in Matamoros, Mexico. And so the CDC has released this announcement that says that if you're thinking about traveling to Matamoros for plastic surgery, don't do it, which I really think the CDC should be saying that like anyway. But
yeah, like just don't go.
Just don't go. So the story behind this, there have been now 5 people who had spinal anesthesia, so like an epidural, so like what you get when you're having a baby, for liposuction, which I think it's crazy to get spinal anesthesia. Like, I mean, to me, it's much easier to get a general. I would never do a spinal for that. But of course, this is why I don't think going to foreign countries is great. But anyway, so they did these spinal epidurals, and of course that does introduce the potential of contamination to your spinal column. So when your your meninges, which is the covering of your spinal cord, gets an infection, it's called meningitis.
Yeah.
And viral meningitis is not something that's critically dangerous, but bacterial and fungal are. And bacterial is probably a little bit higher mortality, but the one thing about fungal is there's no vaccine.
Yeah.
I don't know if you guys have heard, but there is a vaccine for viral and bacterial meningitis, and they recommend the kids going to college get it because of the close proximity in the dorms.
Yes.
But for fungus, there's not. And so they've isolated 5 people so far, which means there's probably more out there. 1 has died, and 4 are still in the hospital. And so this is kind of a serious deal, and these were all tracked back to the Riverside Surgical Center in Matamoros and Clinica K3 in Matamoros. And so just so that people are aware of the symptoms of meningitis, the one that you always hear about like in med school, and it's like the kind of like the classic symptom is stiff neck. It's almost like you were in a car wreck, but you weren't, and your neck's like, oh my God,
like
my neck hurts.
whiplash or something?
Sort of like that, it's just really stiff. Headaches, fevers, another one, nausea, vomiting, confusion, and then sensitivity to lights. So those are the symptoms of meningitis. Especially if you've had an epidural, whether it be in Matamoros or elsewhere, if you ever have those symptoms, please, by all means, go to the ER, because meningitis can absolutely kill you. It's a very dangerous, deadly infection. So with fungal meningitis, if it's untreated, the mortality rate's 100%.
Yeah.
Like if you get fungal meningitis and you don't get treatment, you die, period. Now, if you go get treatment, because there are some pretty good antifungal medications out there, the mortality rate goes to 10%, which that's still pretty high. I don't want to catch something where my chance of dying is 1 in 10. That's way too high for me. If you ever think you might have it, definitely seek treatment. So because these fungal infections are pretty rare, it's not like, unlike sometimes when people get infections, it might be from contamination from someone's skin, either the patient's skin or the surgeon's skin. Fungal infections are more unusual, so more than likely this originated from some sort of like contamination of equipment.
Probably, yeah.
Fungus gets on like some equipment, maybe some of the machines that wash the instruments or the needles, maybe they're reusing needles. So something caused this, but it is a big deal. And I don't know how many times I've preached here on this show about the dangers of medical tourism.
Yeah, they should just outlaw going to Florida and Mexico.
That's a big step. I like what you're thinking. Probably that's a really big step. I like it, but
just
probably
don't have plastic surgery in any of those places.
Yeah, it's a rough one because things like that where you get a contamination of equipment is something that shouldn't happen. And one of the reasons that we have all the safeguards in the United States, and I'm not saying that it can't happen in the United States.
Right.
It can, but it's not common. You don't see that very often where people are dying from a repetitive infection. So I know we talked about medical tourism a time or two, but there are a chance that somebody is seeing this for the first time. So I do want to tell my reasons why I'm against medical tourism. And first off, why do people do it? You know why? Tell them. Cheaper, right? It's quite a bit cheaper. In fact, some of the studies say you can save 40 to 50%.
If it goes right.
If it goes right. God, you should be hosting the show. You're right. You're exactly right. If it goes right, because if it goes wrong, one of the things in the United States is, say, for example, if one of my patients has a complication, well, they don't have to go to the ER. They call me. I say, come to the office. Let's take a look at it. And most of the time, I can just deal with it in the office, and that's it. Well, when you go out of the country and have surgery and you get home and you have a complication, I mean, it's pretty much impossible to get into some doctor's office.
Yeah.
So then you have an ER visit, and that generates a big bill. And immediately, if you have to go to the ER after even if you have insurance, if you have to go to the ER after you've had cosmetic surgery out of the country, like your savings is gone, right? So you're absolutely right. But some of the things that are my biggest concerns about medical tourism, and if you know anyone who might be thinking about medical tourism, please send them a link to this video. Because it's not like I feel like I'm losing business from this. The reason I'm kind of passionate about this is for the last 15 years, I've been treating patients that have cosmetic surgery out of the country. And I treat about, on average, one a month. So first thing is certification of the doctors. I mean, there's problems with certification of the doctors in the United States. We have OBGYNs and internal medicine doctors doing cosmetic surgery in Dallas Metroplex. What's happening in Matamoros, Mexico? I mean, who knows? Likewise with the facilities. I mean, same thing. Facilities in the United States are a little bit more tightly regulated than the doctors themselves, which is odd. But you do have that question of what's happening in other countries.
Yeah.
And then one of the big ones for me is the doctor-patient relationship. And this is why I'm against medical tourism even within the United States, is because when you look at what's one of the biggest causes of malpractice cases, it is a failure of communication between the doctor and the patient. And when you are getting on the internet and searching out this place and saying, I want to have a BBL or a tummy tuck or whatever, you're not really talking to the doctor. You're talking to one of the intermediaries. And a lot of times you show up at these places, you meet the doctor right before surgery, and then you're in and having the surgery. I mean, that's not the way to do things to maximize your outcomes.
No, doesn't feel comfortable.
I don't know. How would you feel about that? I mean, you seem like a pretty reasonable person.
No, I'd feel really hesitant.
Yeah.
I'd feel like I'd have a lot of anxiety.
Yeah.
If I had to go immediately.
Yeah, and just you're on the spot. And then, at that point you're already there. I mean, how many people go and then get a bad vibe and then back out? I mean, probably zero, right? Because you think about you probably.
Because if they flew there.
Yeah, you flew there, and I bet
you
paid.
spent $500 to $600 on a plane ticket.
I bet you pay the money up front. You don't pay after the surgery, that's for sure. So you probably pay before you even get there. So that's actually an interesting question.
Deposit.
Huh?
I bet they have to pay a deposit too, or something.
I bet there is a deposit for sure. I mean, we do that here in the United States because we can't have people canceling surgery because then it just from a business standpoint it's bad. So. But yeah, poor doctor-patient relationship, language barriers. I mean, these are complex topics that are hard to get across when you're speaking the same language as someone. So when you're speaking a foreign language, that could be even harder. One of the biggest issues too is complications generally arise after patients leave.
Yeah.
They go and have the surgery. Everyone's fine in the first few days unless they have bleeding, which is rare, but it can happen. But the more significant complications, things like infection and then healing issues, which are the biggest ones for these cosmetic surgeries, happen after the patients are already gone. And then you get back, and a lot of surgeons in the United States don't want to deal with other people's complications. Like if you call up a plastic surgeon's office and say, hey, I had a BBL and wherever, and I'm thinking I'm having problems, you're going to have a hard time getting in. You're going to get stonewalled in a lot of offices. And then, as you said, you end up going to the ER and spending more money. So.
Yeah.
So, I mean, this is, I guess for people in Texas, this is noteworthy. I mean, I think there probably are a fair number of people in Texas that do go to Matamoros for surgery. Be very, very cautious. I mean, my advice is don't do it 100%, but now even 150%. I mean, there's some contamination going on with fungal meningitis. It's bad enough that the CDC sent something out. I actually got an email from my hospital talking about this.
Yeah.
So it's big enough that it's getting disseminated in a lot of different ways. So I've always said don't do medical tourism. Here's another reason: definitely don't do it now.
Yeah, don't do it.
Don't do it.
Say no.